Once you develop that relationship with the patient, when the dentist said, I'm going to have to refer you to somewhere, the patient's very first sentence is, well, can't you do it? And if you say, hey, funny you ask. Actually, I've had this amazing education and I have these people behind me. I spoke about your case with my treatment planning coordinator. I spoke about your case with my colleague, surgeon. I know exactly how to do this. I feel confident doing that. Are you game? And patients will be more than likely to say yes when they have your trust, which you've gained over the time when you were working together.
We're excited today for today's episode, and we're going to go ahead and hand it over to Dallin for the Ask Dallin segment.
Hey everyone, our question for the Ask Dallin segment today is, how do you objectively evaluate provider performance using data without just relying on gut feelings? So this is a great question. Thank you to our listener who submitted it. When it comes to provider performance, there are two different metrics that we commonly see practices use. One is net production per provider per day, and the other is net production per provider per working hour. Generally speaking, the working hour is a little bit more specific, but it can be a little bit more difficult to get depending on the level of access that you have within your practice management software. The net production part of that is pretty critical, because if you're just looking at a raw production number from your practice management software, oftentimes it's a UCR value that's being posted to the ledger. And so that number is artificially high. It can differ from office to office, and it isn't going to be a great tool for you. So you want to look at your net production per provider, because that's showing you the amount of production that you can actually expect to get paid on. And if you can get that net production number down to the day or even to the hour, as opposed to just the month as a whole, then you can see how much providers are producing within any given time period. If you're in a DSO or like group practice type environment, then oftentimes it can be helpful to compare providers and locations to each other to establish what that benchmark ought to be. As a single location, usually it's not a bad idea to compare notes with others that are in a similar geography or a similar payer mix to you to get an idea of what that baseline ought to be. But that's enough for the Ask Dallin segment. So now we want to hear from Jan. A quick introduction from you, where you're from and what you do. And then let's jump right into the truth that you want to share.
Well, hello everyone, and thank you, Dallin, and thank you, Ken, for having me on your show. So my name is Jan Bublik, and I currently practice in Wausau, Wisconsin. It's right in the center of Wisconsin, and I am a solo practitioner. I graduated from medical school and dental school in Czechoslovakia. So I'm originally from Czech Republic. I am board certified in Czech Republic as an oral surgeon. After that, I went through a AGD program at the University of Rochester, graduated in 2002. Since that, I've been in practice, basically doing everything what's concerning dental implants. We started working with dental implants in dental school in the 90s, where the education was basically not there. So I quickly realized there was a big gap. So when my family moved to Wisconsin from upstate New York, I very quickly became kind of the guy who everybody was talking to about implants because of my background in oral surgery, but also a restorative aspect of that, and got very quickly with bunch of local guys. One of them is an owner of Dental Lab, Dental Crafters. And we established basically an institute called the Restorative Driven Implant Institute, where our goal is to help educate general dentists. Mostly, we also have a few specialists coming through our program, but educate them about what's good, how you can benefit from learning dental implantology, basically the right way, where you're not practicing alone. You can bite as much as you feel that you can swallow, and have a group of people who actually stick together and help you out through that journey. Practicing in here for over 16 years, and before that in upstate New York for 10 years. So I've got close to now I'm going on close to 30 years of experience in oral surgery, dental implantology and, everything, everything around that area. So I've been around the corner quite a bit.
So what would you say? I'm really curious about this
Sure.
because you certainly are interacting with a lot of different people with different skill sets in this
Yep.
modality. So I'm really interested. What is sort of the number one misunderstood thing that you find when there's a provider who wants to perhaps, go after this modality and learn about it and do CE around it? What would you say is probably the number one thing that they need to know, but they don't?
So I think that many of the current clinicians coming out of dental schools are really in the mindset of stratifying the care, meaning this thing will be done only by oral surgeon or periodontist. This thing can be only done by orthodontist. This thing can only be done, I don't know, by endodontist. And in reality, general dentistry is just such a broad and beautiful specialty. And, what I think is missing, there's one thing which is missing, but also one thing which, might be in some instances expressed a little bit too much. One thing what's missing is clear understanding of reality of your skills, your skill set. If when I've seen when young practitioners come out of dental school and they are really good clinicians, yet they are held back by the only thing they know from the dental school, which say, don't touch this. This is not for you. It's like if it was some sort of magic, that you're not allowed to look under the hood of this car, don't touch that. That's why we go to dentistry, to figure out how things work, and how we can make it better. I always say, the fact that you graduated from dental school gives you two things. Number one, enormous amount of debt. But number two is gives you the right to educate yourself further. And you really need to take that, bull by the horn and go and ride it. It might be a bumpy ride, but if you have the guts, it's going to be really enjoyable. That doesn't mean that you need to be a cowboy and, do everything what you saw on YouTube and everywhere. But you need to surround yourself with the good people who have your best interest in mind and help you out in the journey you select.
I love that. I think this is a fascinating topic of conversation to get into. And I appreciate that we can have it with you because it seems like you're a pioneer when it comes to implants and dentistry.
Yeah.
So grateful that we can have you here for this. If I could take the role of devil's advocate just for a moment, because I'm trying to put myself in the mindset of this student coming out of dental school. Sure. Our modern economy is based on specialization, right? It's based on the fact that Jan gets really good at something so that Dallin doesn't have to. And Ken gets really good at something so that Dallin doesn't have to. And Ken will do his thing and Jan will do his thing and Dallin will do his thing. And we're all going to help each other and creates this economy of sharing and capitalism, and rising tide floats all boats, and it's great for everyone. So with that context in mind, I could see that being the narrative that a dental student is saying, where they're saying, okay, well, I'm just going to, I've got my one thing that I do and I'm just going to get really good at it. And the endodontist is going to be better at endo than I ever will be, or the oral surgeon is going to be better at surgery than I ever will be, and let that be the motivation to avoid learning specialties and instead refer out. So I'm sure you've seen that concern come up before. How do you address that?
You are absolutely correct. So the way how I see it is, the group which we bring together and which we foster our attendees in there, it's a group of communication and a group of people who want to get better at stuff. Just like, Dallin, 2 years ago, I don't think you might have been, I don't know if maybe you were, but maybe you were not using AI, to improve your services, right? And it doesn't mean that you're cheating or anything. It's still you, but you're learning something new. And that's what we are doing. We're not using AI during our teaching seminars, but we are bringing people together and just give them an options like, look, you can do these things. And the reason why you can do that is because before you even start from the planning perspective, you have these people you can talk to. You can learn these things, these principles, and then you can do the surgery. Why do you need to do that? Because, okay, maybe the surgery could be done better by a specialist, but you need to understand what do you ask your specialist of. You need to tell the specialist exactly, I want this, and that, and only blindly refer there because they might be, for whatever reason, better at something or not. Doesn't mean that the patient gets a better result. That doesn't mean that, because you need to know what, that specialists know. Doesn't mean you need to perform it, but you need to know that. That's always, anytime there is some sort of complication and comes back to the general dentist, the general dentist then calls the specialist and asks them about, how to restore things. They've never restored anything. They just know what they do or what they did, but the long-term process, the long-term, prognosis of that, that's kind of beyond what they know. So that's where our education really focuses on the entire process. The surgery itself, patients heal the way how patients heal. Some of them better, some of them with complications. But, we guide you and we guide our attendees through the entire process, from the treatment planning, through the surgical part, creating a three-dimensional guide, making sure they understand what's on the cone beam CT, placing the implant, understanding the healing, understanding what happens in the laboratory, how they look at the case, and so that the patient get the best result. And you then can choose which part you want to do. We don't teach you to place implants. We teach you how your patients will get the best result with the implants you treatment plan. If you choose to, you can place them. If you choose to, you can restore them. That's the biggest difference. Did it answer your question?
Yeah, it answered my question perfectly. And if I could just restate back to you what you said to make sure that I understood, it's like the benefit of cross-training. So even if you don't end up becoming an implant specialist, as much education as you can get in implants will make you a better general practitioner. You will give better and more informed referrals to the implant specialist, but you will also know how to work better with people who have been to an implant specialist. Maybe you'll know what actually needs to be referred and what could better be done in-house. Or there could come a time when you get good enough at it that you could do it yourself and you're creating a better patient experience because they can stay in the chair and not have to go to a whole new center to continue their care.
100%. You guys know, and any dentist who has worked, more than 2 years in one spot knows that once you develop that relationship with the patient, the very first thing when they say, when the dentist said, I'm going to have to refer you to somewhere, the patient's very first sentence is, well, can't you do it?
Yep.
And if you say, hey, funny you ask, actually, I've had this amazing education and I have these people behind me. I spoke about your case with my treatment planning coordinator. I spoke about your case with my colleagues, surgeon. I know exactly how to do this. I feel confident doing that. Are you game? And patients will be more than likely to say yes when they have your trust, which you've gained over the time when you were working together. So that's a huge advantage.
That's amazing. Now, we're going to be needing to wrap up the episode here coming up, but there's one thing that is really interesting to me that I know is very important to you, and that is that dentists have a community around them that can help and support each other. Could you maybe tell us just a little bit about how you think about building a community, and for those listening, how they might be able to find a community that could help them upskill if that's what they're looking for, or just, improve their mindset in some way?
Yeah, 100%. So, since I'm part to the, Restorative Driven Implant Institute, we have our own, if you will, it's on a Facebook, it's our own community page. So anybody who has ever gone through, RDI gets an instant access to our community. And over there, we discuss, the cases. People post, because they're geographically from a large area. So they post their cases and questions and answers. We have some case reviews. We have literature reviews once in a while. we get 6 times a year, we get together for, for core teachings. So that's what we do, because we know it's important for people to stay connected. I'm also leading a study club, and I make sure it's one of the Spear Study Club, which I love the system. I love the concept. What I don't necessarily love about that is that it's usually driven by a specialist. Then the general dentists are looking at that like, hey, what do you tell me what to do? And many times the specialists are, educated in their own area, as opposed to seeing the whole general dental picture, what the dentists are seeing. So I would feel that's probably the biggest difference. I don't know if that answered your question or not, Ken.
Well, no, it did. And it, I think, emphasizes why having a community
Yes.
of not necessarily like-minded, maybe they're somewhat like-minded, but you also some not so like-minded to challenge the status quo, right? And to get to the best outcome.
You're 100% correct. Like-minded community is called a cult, and we want to make sure that we have people with our different values, different ideas, different understanding, but mutual respect, and that's what I love about our community.
Amazing. Well, it seems like you're building an incredible thing. We're grateful that you've come on today to share everything that you've learned. Do you have any final thoughts for our listeners? Any concluding remarks before we wrap up?
Well, the only thing what I would love to say, if you ever had any inkling about, learning more about dental implants, we would love to have you at RDI, Restorative Driven Implants Institute. And, just as it's on a bumper sticker, come and see.
Come and see. Well, thank you. If people are interested in talking to you about the community that you're building, about implants, what's the best way for them to reach you?
So the best way to reach us, it's through the website, restorative-drivenimplants.com. And you can talk to our coordinator, who is, used to be my dental assistant. She is a wealth of knowledge. And, I could be reached at drjanbublik.com.
Sounds good. Well, thank you again for coming on. And to everyone who is listening, we will see you next time.
Thank you for having me, and thank you for what you guys doing for the dental community. I really appreciate that.